woman presents with progressive fatigue, difficulty swallowing, and tightening of the skin on her face, chest, and arms. She also reports joint stiffness and shortness of breath. On exam, there is skin thickening of the upper arms and trunk. ANA is positive, and Anti Scl 70 antibodies are detected. Which of the following complications is most strongly associated with this patient's condition? A. Interstitial lung disease. B. Digital ulceration. C. Pulmonary arterial hypertension. D. Anti-centromere antibody positivity. E. Mucosal neuromas. Correct answer A. Interstitial lung disease, diffuse systemic sclerosis, is associated with Anti Scl 70, anti-topoisomerase 1, and carries a high risk of interstitial lung disease, ILD, particularly fibrosis. ILD is a major cause of morbidity and mortality in these patients. Why not the others? B. Digital ulceration, seen in both limited and diffuse disease, but not as strongly associated as ILD with Anti Scl 70. C. Pulmonary arterial hypertension, more common in limited cutaneous systemic sclerosis, associated with anti-centromere antibodies. D. Anti-centromere antibody positivity, seen in limited systemic sclerosis, not diffuse. E. Mucosal neuromas, associated with MEN2B, not systemic sclerosis. Question 2. A 46-year-old woman presents with Raynaud phenomenon, dysphagia, and progressive skin tightening over her chest and proximal limbs. Physical exam reveals sclerodactyly and loss of facial wrinkles. Laboratory studies are positive for ANA and Anti-Scl 70 antibodies. Which of the following best describes the pathophysiologic role of the autoantibody most specific to her disease? A. Autoantibody against DNA topoisomerase 1 promoting fibrosis. B. Autoantibody against histidyltRNA synthetase, inducing alveolitis. C. Autoantibody against centromere proteins, preventing cell division. D. Autoantibody against type 4 collagen, damaging basement membranes. E. Autoantibody against ribosomal P protein, leading to psychosis. Correct answer: A. Autoantibody against DNA topoisomerase 1, promoting fibrosis. Anti Scl 70 is an autoantibody directed against DNA topoisomerase 1, a nuclear enzyme. Its presence correlates with diffuse systemic sclerosis and progressive skin and internal organ fibrosis, particularly the lungs. Why not the others? B. AntihistidyltRNA synthetase Jo1, seen in polymyositis dermatomyositis, especially with interstitial lung disease. C. Anticentromere, seen in limited cutaneous systemic sclerosis, not diffuse. D. Anti-type 4 collagen, seen in Goodpasture syndrome, affects kidneys and lungs. E. Anti-ribosomal P protein, rare, associated with neuropsychiatric SLE, not scleroderma. Would you like